What's going on, guys? Tony Maritato here, licensed physical therapist, and in this video I want to talk to you about a study that came out in 2019 looking at the outcomes, the effects, the benefit to patients from having a real surgery, a sham surgery, or no treatment. And then they're also going to look at a progressive tendon loading program, basically an exercise program that lasts 12 months with a physical therapist. So if you're looking for a reason that maybe you want to put off that rotator cuff repair surgery, this might support your decision. Let's take a look at it. I know that it's small up there on the screen, but I'm going to go ahead and read through some of the highlights to help you understand what's going on. So the title of the study was "How Does Surgery Compare to Sham Surgery or Physiotherapy as a Treatment for Tendinopathy? A systematic review of randomized trials." So they're going to go out there, they're going to look at all the trials, they're going to have a selection criteria to pick the best ones that they can find specific to the topic. The purpose of this, to assess the effectiveness of surgery on all tendinopathies by comparing it with no treatment, so obviously no treatment, sham surgery. Now, a sham surgery is basically where they take a group of patients that are appropriate for surgery. One group gets the actual surgery, in this case, rotator cuff repair. The other group gets a fake surgery. They prepare the patient, both groups the same. They bring them into the operating room, both groups the same. They say the things that they would say. They even cut the skin in the places they would normally cut the skin, but they don't actually do the surgery in the sham surgery group. So it's a fake surgery group. Where are we? Sham surgery and an exercise-based therapy for midterm, which they're referring to 12 months as midterm, and long-term, which is greater than 12 months. So they're looking at these different conditions: real surgery, no surgery, sham surgery, and exercise group. Okay, 4 groups. The results. So we recommend that healthcare professionals who treat tendinopathy encourage patients to comply with loading exercise treatment for at least 12 months before the option of surgery is seriously entertained. Now, I'm going to put a caveat in front of this. There's a great YouTube video out there from a researcher, and he basically says, if you've had an acute injury, if you've had a specific event like a fall, you fall off a ladder, you fall off a roof, you're walking your 120-pound Doberman Pinscher and he takes off running and he yanks your arm. If you've had a specific injury to the tissue that results in a rotator cuff repair, that is a good candidate for a surgical intervention. But if you just gradually develop this soreness, achiness, turns into pain, turns into decreased function and limitation over time with no specific event, you might want to think about the findings in this article first. So let's jump into a couple of these. What do we already know? We already know that there's a lot of debate surrounding the role of surgical intervention for chronic tendon diseases, whether we're talking Achilles tendinopathy, rotator cuff tendinopathy, biceps tendinopathy. Sham surgery trials are the gold standard against which to judge the effect of surgery on a clinical condition. So the only way to really know how effective surgery can be is to compare it to a group that thinks they got the surgery, but they really didn't. And so some of the new findings that come out of this literature, in it, they looked at 12 eligible randomized controlled trials in patients with various tendinopathies. Surgery was not superior to sham surgery in patients with tendinopathy in the mid and long-term time frame. So midterm was 12 months, long-term was longer. Tendon loading exercises are as effective. I mean, this is just crazy. Tendon loading exercises are as effective as surgery, both in the midterm and the long term, for patients' pain, function, and quality of life. Now, most of my patients come to me because they're in pain, they've lost function, and they're not satisfied with their quality of life. But to explain or make that shift to say, well, I can get surgery and I'm done tomorrow, or I can spend a year doing a tendon loading program, which is a progressive exercise program. That's a hard sell. But if you're somebody who wants to avoid surgery at all costs, it's got research behind it. I mean, there's no benefit to anyone to put research out like this that actually lowers the cost of healthcare. But this is what they're saying. And then, of course, surgery should be reserved for selected cases and only after sufficiently long course, 12 months or more, of evidence-based loading exercise has failed. So here's the thing, guys, I think this is a great article. It opens the door for the conversation between you and your surgeon to say, hey, these would be the questions that I would want you to ask your surgeon. I would say, doctor, if I had surgery today compared to having surgery in 3 months, 6 months, or like the program says, 12 months, am I going to be any worse off? Am I going to be worse if I wait and I do an exercise program? What's the worst that's going to happen? What's the tissue going to be like then? I have to say, most of the times, your surgeon is probably going to say the worst case scenario is you wait, the pain continues to persist, but the tissue is going to be healthier. You're going to be healthier. Your body is going to be able to recover from surgery better. So it's not that bad of a trade-off. Now, of course, if your surgeon determines that there is a serious risk and opportunity for further damage, now you make a different decision. But not I, not the researchers, nobody else out there can make this decision for you except you and your surgeon. So that's why it's so important that you have a surgeon you can trust, that you can talk to, that you can spend time with, to really say, look, this is all the stuff that's going on in my life. And the questions I would tell you to ask are, do you have a support system at home? If you're going to have a rotator cuff repair, you're going to be in a sling for 4 to 6 weeks, most likely. You're not going to be sleeping well at night. You're not going to be able to drive yourself to your physical therapy appointments or any other appointments. You need a solid support system. You also want to take into account financial considerations. Are you still working? Can you take the time off of work to have a full recovery? That might be 6 to 12 weeks, depending on your occupation. Are you going to be able to financially afford this? Is it something that you don't want to have at the end of the calendar year if your insurance benefits are going to reset and now you're going to have the added cost of rehab in the new calendar year? You want to think about environmental factors. It's one thing to have a rotator cuff repair and be in a sling in the middle of spring, but what if you live in a cold climate and the ground's icy and you need to get in and out of your car? Heaven forbid you slip right after your repair. So I will do my best to put together some new videos that talk about things you should consider before having your rotator cuff repair surgery and how you can best plan for when is the right time to have it. But I just wanted to share that article with you to say, look, we don't have a definitive black and white answer to say, yes, you need to have it or no, you don't. There's lots of individuals, there's lots of studies out there that show there's individuals with pain in the shoulder, but no tears. There's individual with tears in the rotator cuff, but no pain. And there's kind of everything in between. So I would just ask you to do your research, do your homework, look up these articles, talk to the people that you trust. And if you have questions about this, feel free to post them in the YouTube comments below. I'm happy to get to them the best I can and share more resources if you're interested. Thank you so much for watching. I'll catch you on the next video.